go?
I'm ready.
Hi, folks. I'm Bob Schrupp, physical
Brad
therapist.
Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course,
Jumping
Bob.
the gun there, Brad. Today, we're going to talk about 60-second treatments to heal tennis elbow. This is a trigger point therapy. I'm going to be honest right from the start here, Brad. I wasn't a big fan of trigger point therapy throughout the past couple of years.
I'm glad you're honest, Bob.
But it's turning me around. I got a book on it, and this is based on the work of Janet Travell, who's she's an MD, and David Simon, who is an MD. They both are no longer alive, but they spent their lifetime basically developing this system of treating trigger points.
Sure.
And I mean, it's well respected by a lot of therapists,
Right.
so I'm not pulling something that's weird out here.
Well, I have Pam. She does most of my trigger point because she's good at it.
Right.
She's better than me, so I just let her do it. And so
and you see results,
right.
don't you? And that was the same with me. I had a PTA that was big into that, and I especially there's certain people I would be better with, and others ones that she'd be better
Sure.
at, and it definitely did work. So. By the way, if you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, if you get a chance, go over to Facebook. It's right here, Bob and Brad, and like us because we are giving out cool vibes to anybody who...
Oh, yeah. We'll get rid of those trigger points.
We're putting out the vibe. Do you know what that's from, Brad? Putting out the vibe?
No.
It's from Dumb and Dumber. Do you guys have saw that movie?
Oh, really?
He stood and he said, yeah,
one of my favorites.
I'm putting out the vibe, he said. All right, so what is a trigger point? By their definition, a trigger point is a hyper-irritable spot in the muscle, and it's usually got a nodule there, and that nodule is kind of hypersensitive.
Right. I had a therapist, she said it'd be when you feel around that muscle, you can feel like a Tootsie Roll in there. It's about that size, and it's a muscle all tightened up and knotted. You got to get that knot to release so that blood flow can get in there and starts to feel much better, as well as
That's a good explanation. Yeah, that's I saw in this other book was more for the layperson. They called it a grumpy spot.
Oh,
so
sure.
So anyway, we're going to talk about treating lateral epicondylitis today, which is tennis elbow.
Okay.
So that's usually, you're getting pain out here a lot of times when you grip.
Sure.
Especially be the person who does play tennis. You might feel it in golf. You might feel it in, although there's golfer's elbow too.
Sure.
You might feel it when you're painting or hammering or anything where you're gripping it a lot. So.
And it can be real tender. I know when I had it, if I walked through a doorway and it just touched that area by accident on the wall or the door frame, wow, that wakes you up.
Now you want to show it on the lateral epicondyle where it is?
Sure.
So,
yes.
So.
I'll be right back.
He's going to come back. Oh, he's bringing Sam.
Sam, I am.
So as you look at the humeral bone here, right down here, we got a bump on the outside. And that's the lateral epicondyle. And that's where we got 3 muscles that attach to it. And those 3 muscles can have trigger points in them, and they can pull on that bone harder and give you the tendonitis. So we're gonna release those 3 muscles basically by working on the trigger points.
Right. So when the muscles release, then the stress comes off the actual source of injury, where the tendon connects to the bone.
So the first one we're going to talk about is the Extensor Carpi Radialis Longus. A lot of words there, but we're looking at this muscle wad right here. They call it
the wad. The wad of muscle.
It's the hairy side of your forearm, and it's right here, and it attaches into the bone. So the way you're going to find the nodule or the trigger point is you're going to go down 1 inch from the crease, and you're going to go over 1 inch. So I went down and then over. I'll mark it then, Brad. Yeah, down and then over.
So there you go. You can tell you got some muscle. That's the muscle belly.
So right there, and that again, this muscle helps bring the wrist up, and I think it even pulls it a little bit over towards the thumb.
Sure.
So.
I have to use a strap so I can see mine. I don't have...
No, you're going to do that for the brachial radialis.
Oh, I get to do the brachial.
Yeah.
That's kind of amazing. You got these fancy names, brachial radialis, and then they call it the muscle wad.
Yeah, the muscle wad,
They go from one extreme to the other.
So you found the spot, 1 inch down, 1 inch over. Now you can just take your knuckles, and you can go ahead and work into it, and you're going to kind of rub and circle and work right over that area. And you can do this, all you have to do it is like 10 to 12 times, Brad. Mm-hmm. And twice a day, and then you're done with that muscle.
So I'm going pretty aggressively.
Very aggressive.
So it's painful.
Yeah, it's painful, yes.
But when you're finished,
It should start to release.
Right, and then as a result, maybe in 5, 10, 20 minutes, it feels better.
Right.
If it doesn't after that long, then maybe you went too aggressively or it's not the right treatment.
And I don't know that you're going to see an improvement in your tennis elbow. It may take a while. That may take several days or even a couple of weeks.
Sure.
But this is the thing you're going to try. Now, you can also use a lacrosse ball or some type of ball. You can kind of put it right over the area. And believe it or not, this is actually goes at it a different way and actually does quite, does a different, it's a different job.
Right.
You found that out, Brad?
Yep, yeah, it's got more surface area than your knuckle. If you don't know what a lacrosse ball is, you could use a tennis ball, but this is a solid rubber ball. It's
very
pretty
solid.
And they work good. You can play bouncy with them and things like that. Well,
all right, and the last one we're going to use, Brad, here is the Pure Wave Massager. This comes with different attachments. We're a big fan of this massager, especially if you've got problems all over the body. This is going to help with that.
Right.
It's got that air-filled one that's really quite nice, but this is actually the pointer stick one, and so you can see. And by the way, this percusses.
Right.
It just doesn't vibrate. Yep, it actually kind of goes like a jackhammer. So I can get right in there. And this baby works.
Right. It's pretty aggressive. You want to keep it away from the bone. You'll notice if you get too close to the bony area, it's going to become painful in a different sense, and you don't want that.
I'm right in the thick part of the muscle
here,
so it tolerates it pretty well. I don't know that I want you to go out and buy one of these just for this.
Right.
I'd want you to try the knuckles and the ball, the cheap version. But if you think you need it for other reasons, then by all means. I mean, it works out well.
Right.
So next one we're going to do, Brad, is that Brachial Radialis. You wanted to show that one, right?
Yes, I did. That's why I got my strap, because mine doesn't really show out until I pull up like that. If I go like that, then
he's got his thumb up, and when I go my thumb up, it's the same thing.
It's like going hitchhiking there.
And it's that muscle right here that goes along here, again, attaches into the lateral.
There it is. So we're going to go right on that muscle?
We're going to go, on this one, we go down 2 inches. We're actually going to go down 2 inches and hit it.
Okay, a little bit further down.
Yeah, a little further down.
So it's just about 1 inch or 2 down from the previous spot. Mark's going to mark it with another green dot.
So see, it hits it there. I'm a little bit over.
You don't have to mark yourself at home.
No, you don't.
You'll find it.
So again, I'm going to go 2 inches down from the crease, and that's about where it is at. So you don't really have to move over with this one. This one, this one we had to move over 1 inch.
Sure.
This one you just go 2 inches down, thumb up, and it's right there.
Yep.
And it's a spot. I got it.
And the same thing, knuckle, lacrosse ball, tennis ball, or if you have the massager, that would go.
Again, 10 to 12 times, a couple times a day.
Yep.
Work out really well. All right, the last one is the Supinator, which does what, Brad?
It supinates.
I know, but what is supination?
Palm up.
Yeah, palm up. And you always remembered it by you have to carry a cup
Right, if
of
you
soup,
got a bowl of soup, you put your palms up to hold it like this. That's,
See, there's a pronator and a supinator.
Right.
So now the supinator is actually below, underneath that brachial radialis muscle. So you actually have to move the muscle over a little bit. You're going to still go to the 1 inch mark.
Yep.
It's the 1 inch.
Okay, the closer one.
Yeah, the 1 inch. And you're going to push it over a little bit, and it's right in there. Right in that spot underneath.
So actually, when you're doing that, when you're kind of working the other ones too a little bit.
A little bit.
Yeah.
I mean, you're
stretching them or working them a little.
Exactly. So you're going to get all three.
It's deeper. You can tell you're getting in deeper to the bone.
But what's nice about it is because it's only 10 to 12, reps or whatever massages. You can do this fast.
Sure.
You can go bing, bing, bing. And they really are 60-second treatments.
Right.
So that's the way to go at it.
So once you do it a couple of times, you get to know where to go, what it feels like, and it becomes very quick.
Certainly no downside to it, and that's why I think it's well worth a try.
Sure.
And give us some feedback. Let us know if it worked for you. And remember, Brad and I can fix just about anything
except
a broken heart.
But we're working on it.
We are.
And we're going to continue. That's our nighttime homework project.
There we go. Thanks.